Thank you very much, and really for all your significant efforts. I think there was about 6 open fire hydrants of input coming in, which Doreen had to kind of fill a bucket for which I think was a kind of very useful kind of paper of some significant input. But we just have about 5 minutes for a couple of questions before we have a break, and so I don't know if there's any burning questions, and both individuals will be on the panel, but Susan has a question over here. Susan Anderson.
Just a quick question around the elasticity of your policy direction. You mentioned a lot about the patients and the providers. Do you see this expanding for the citizens and the consumers, in particular in the area of expanded information coming from the public side as a match to the information that's contributed by the health system for social determinants of health, monitoring, et cetera? Thanks.
I think we'll both respond, but thank you for that question. And I appreciate you, again, sort of pointing out the fact that I coming to this discussion as a healthcare provider, my apologies for my own myopia in terms of the presentation. Absolutely, the vision for the integrated health record is not only on, it's not only to elevate the quality of health care provided in the province, but it's to elevate the health of our communities. And so my apologies for tending to have a bit of a healthcare-centric view when discussing it, but you're absolutely right. One of the advantages of the IHR is that we're now reaching deeper into the community, really trying to focus on health promotion. And as has been brought up in the speakers this morning, is the central role of primary care in terms of empowering them to do more in terms of health promotion and de-emphasize disease treatment. And again, having that interaction between different stakeholders in terms of public health. So having those connections with having that interface between legislation and the healthcare system is very, very powerful in terms of the social determinants. So again, understanding how issues like education and again sort of and better interactions between public health and the healthcare service will certainly lead to better outcomes, and I think there's a lot of potential there for synergizing efforts to making our communities healthier.
Yes, as part of the paper, it is recognized that policy and practice needs to evolve. And part of that is to look at our provincial policies, our legislation, and harmonize the legislation and the policies with the needs of today's world. And so we recognize the continuum, the justice, the education, all of those children's services, all those needs and those programs and how they push the person into acute or maybe not, and learn from that. So there is a desire to enhance the legislation to support this type of work. We have a ways to go yet. We've got a little bit of learning to do, but certainly there's the willingness to look at it.
Okay, and just one last question. Tracy, I think you had a question.
Hi, good morning. Tracy Boslick, Alberta Health Services Strategic Clinical Networks. I just want to commend you on the work. I think it's a great start. One of the things, recommendation number 1 was about making sure that professional bodies have access to net care. So I know we get pharmacy information and physician information, and I'm wondering about the strategy for nurse practitioners, community physiotherapy, and complementary therapists who to the patient's perspective is their team, and where are we in really pushing the boundaries on who has access and who can contribute to really round out that experience for people.
Good question. Thank you, Tracy. We have just worked with the chiropractors, dentists, and optometrists to bring them into Netcare. Some of them are underway. Some of them are already experiencing pilot projects. We do see the benefit of adding other healthcare providers. So instead of changing the act every time a healthcare provider is seen to be a valuable part of this system, as we go to amend the act, bringing in the health professions ACT linkages would be really very beneficial. Obviously, that's not my decision, that's a government decision, but we do recognize the need for both public and private healthcare providers to not only access Netcare as in relation to their scope of practice, but contribute those learnings that they have in their offices. So it's a bit of a journey, but we do want to move there. There's a number of them. Physiotherapist is one of the ones that I've heard needing to be part of the team, and and I think there's a number of other ones. So.
Okay, and so thank you very much. I'm just, in the interest of particular time, and both Kim and Doreen are going to be on the panel at the end of the morning. So we'll be taking a break, and I'd like you all to be back at 10:58. We'll be starting. But thanks very much and, for all the speakers for the first session this morning. Thanks very much.